Okay, ready to go? Okay. Well, first of all, thanks a lot for being here today, especially under the circumstances. You know, nothing more important to get out and clear communication, and you perform an incredible role for doing that, not only for our internal audience, the Air Force, but also for the nation. You know, Secretary Esper's priorities have been crystal clear for us. We categorize them as people, mission, and partnerships. And so what I'm here to do today is talk to you a little bit about how we as an Air Force are responding to the virus. So we're still conducting global missions around the globe, which is priority one. We've got fighters, bombers, maintainers deployed, working to keep America safe, and we're still flying global mobility missions and conducting global space operations. So in the global missions that we as an Air Force support and the Joint Force, all those missions continue. We're also focused, as you might imagine, on conducting a nuclear mission, managing two-thirds of the triad, and of course the nuclear command and control in support of Admiral Richard. And we are keeping our training pipelines open, and I'd be happy to talk about that in Q&A in terms of some adjustments we're making to keeping those pipelines open. As Secretary Esper has reminded us, our focus first and foremost is on people. And that's not only our active, our guard, our reserve, our civilians, but also in the communities in which they live. We've communicated with all echelons of command. Some of you may have seen an open letter to commanders I put out this past week, and just emphasizing to them that that communicating is as important as anything else we do. I do have some folks that are with me that I'd like to introduce to you. First of all, Lieutenant General Dorothy Hogg. Dot is our Surgeon General, Air Force Surgeon General, who will help me out with any kind of medical detail questions. Our lead of the crisis action team in the A3 is an Air Force reservist, Brigadier General Rob Blake. He was here as well. And then Lieutenant General Brian Kelly is our Air Force A1 Director of Personnel. So with that, we'd be happy to take your questions.
Okay, Bob.
General Bob Burns with AP.
Hey, Bob.
Good morning. How many members of the Air Force currently have been confirmed to have the disease? And also, what are your advisors telling you at this point about looking ahead maybe even 1 month from now or 2 months from now? What percentage of your force do you think might be incapacitated by this?
Yeah, right now numbers are small. Knock on wood, we've got 7 active duty cases that we have right now. You know, as Secretary Esper said yesterday, you know, we are generally a younger and physically fit population, so tend to be a little bit more resistant to the virus. So not surprising to me that our numbers right now are low, but we're taking it very seriously, and I'll call Jill Hogg up here to talk to you a little bit about the next month and what we're seeing in the future.
Yes, sir. So we do know that our cases will increase, just like they are in the general public, and so we are paying attention to those cases and identifying contacts and implementing measures to decrease exposures. So social distancing, doing single point entries into the medical clinics to make sure that we're separating the two populations if someone were ill.
But do you have any projection of how many might, you know, be incapacitated by the disease even a month from now?
So the projections are difficult because there's a lot we still don't know about the virus. We do know that the virus is highly infectious and that the virus does infect anywhere from one person can infect 2 to 2.5 other people. And so we're looking at that and using that as our planning factor.
So you don't have a figure at the moment?
I do not.
Okay, back number. Sorry, go ahead, Vivian.
Oh, Vivian Mashi with Defense Daily. Thank you for doing this. I wanted to ask you about the status of the Advanced Battle Management System experiments that were supposed to happen in April and for 3 months thereafter. Can you share whether it's been delayed, the April one specifically, and what's going to happen from now on?
Yeah, thanks, Vivian. It's actually been postponed till June. So right now, really important that we're not canceling it, we're postponing it, and we're because you know there's a number of industry leaders that are also involved in this with this. You know, we in April were postured to take the entire all the joint chiefs were going out, chairman, vice chairman, all of the joint chiefs were going out to be part of the demonstration. We want to put that back on in June. Right now, so it's a postponement versus a cancellation, and then we want to make sure we get right on track as soon as the conditions allow us to.
Okay, and is Dr. Roper and the Air Force at large, is there anything that they can do in the interim to continue the experiment, even if it's not the massive demonstration that he was hoping for.
Yeah, so what we're doing is using the time to advance some of the technologies, because, when we did this in December, we had 26 of 28 of the different line elements that we were working on work. When we got back and did our after action, we actually thought that was too many. Maybe we didn't stretch ourselves. So this one is significantly larger. We're trying far more new things and trying to connect capabilities that are not currently connected. And so we're going to use this time to advance those technologies so that we can even try more things. If we get this right, about 60% of it will work. 40% won't work at all, and we'll learn from that and we'll move forward. So we're doing this in every 4 months, and so this one has been delayed.
Okay, let's go to Marcus on the line from Defense One.
Can you hear me okay?
Yeah, go ahead, Marcus. You got it.
All right. I just wanted to ask, how is the Air Force helping to ferry around coronavirus test kits? Is the Air Force playing any type of role in that?
Yeah, we are. As a matter of fact, we had a meeting with the Secretary of Defense, and one of the things we talked about was our global mobility capacity for moving personnel supplies throughout. You may know of a mission that we are, currently involved in, moving test kits, all in support of Homeland Security, to make sure that we are Health and Human Services, to make sure that we're meeting the demands that they have. So, one of the things that we have is a rather robust global mobility portfolio. We do this all, Marcus, working with and through Transcom Commander, who has that responsibility, and the Transcom Commander is closely connected with Health and Human Services to make sure we understand their demand signal.
Okay, let's go back to the room. Tara?
Thank you, sir. One, can you tell us if any of your bases have had test kit shortages, how testing is going on base? And then secondly, for keeping flying missions current, getting everyone their hours, as you know personally, a cockpit can be a pretty close quarters place. Are you taking temperatures of pilots? What sort of steps are you doing to prevent the spread among your aviators?
Yeah, so right now we haven't seen or had a report from any of our wing commanders on test kit shortages. I think to a large extent, if you go back to the numbers of cases we've actually had, 7 across the Air Force active duty-wise, we haven't had a significant demand signal yet for test kits, but we are, like all the services and like the nation, looking at test kits overall in terms of what we may need to see in the future. In terms of, can you repeat your second one again?
For pilots, how are you keeping
yeah.
such close quarter?
Yeah, so early in this process, I talked with General Marianne Miller, who's our Air Mobility Command commander, because global mobility into and out of level 3 countries has to continue, and so she has measures in place that isolate the crew, mitigate the risks, so we can continue to fly into, knowing that the global landscape will change, right? Level 2 countries will migrate to level 3. This is going to be a changing dynamic, and what we've got to do is to continue to, even if you're a level 3 country, like let's say Italy, Aviano Air Base has still got to fly. They can't fly unless they have parts. They've got to have continual supply, and so we got to keep this global mobility mission running, but not only inside the Air Force, but I can make an equal case for the Army, the Navy, the Marine Corps. We do the much of the resupply, so she has procedures in place, and she's working those along with the Transcom Commander to make sure we can keep global mobility up and running.
Could you describe a few of those procedures? Like, do they involve taking temperature of crew or?
They do. Screening, temperatures, isolation in terms of social distancing. We consider the aircraft itself a clean environment. And so while they're in that aircraft, the longer they're in that aircraft, they're actually in an environment that is not of a concern. It's when they leave that environment to go to their rooms or what have you. So we're really minimizing movement and keeping them in a bubble, if you will, to make sure that we can keep the force size we need to be able to maintain the missions.
Okay, let's go to Valerie and Senna from Defense News on the line.
Yeah, can you hear me okay?
Yeah, go ahead, Valerie.
So I kind of wanted to check in following up on Tara's question and see if you had any broader concerns on the logistics or supply side of the house. So, like, for instance, has the Air Force been able to order what it needs from a medical standpoint as far as, like, really mundane items? Is it able to buy the food and necessities needed to stock commissaries? And then are you guys able to get the supplies and parts that you need to continue to do the flying missions that are your bread and butter? So, like, where are you seeing any challenges or pressure?
Yeah, thanks, Valerie. You know, with respect to, you gave the example of commissaries, you know, all the other base support facilities. We're working to manage that at the local level. So the letter I put out, the note I put out to the wing commanders really stressed that our job is to arm them for success based on open communication so we know their needs. So right now, in terms of stocking commissaries and other on-base facilities, we're able to meet the need going forward. Obviously, that's an ongoing dialogue as the dynamic changes going forward.
Okay, back in the room, Laura, and then over here.
Hi, Sarah. Laura Seligman with Politico. Can you please talk to us about the capability of some of your mobility aircraft that have this infectious disease capability? I know I've seen some mods that roll on, roll off.
Yeah.
Are you preparing to use? Are you currently using that capability? Are you preparing to do that? And then also, do you have any Air Force medics who are coming out of school or already in the field who are preparing to relieve civilian hospitals right now?
Yeah, thanks, Laura. So first of all, we actually had this conversation with the Secretary and the Chairman. You know, as we look at the different capacity that each service brings, one of the things that we bring is aeromedical, and we do have the capability of not only using existing aircraft, but we also can modify. You know, not only in the air but also on the ground, right? In terms of being able to take a facility and turn it into a expeditionary location. We do that in combat all the time. So I'm going to ask General Hogg to sort of give you more specifics on this, on the kind of kits we have and what we're looking at. In terms of medics, you know, one of the things Secretary Esper mentioned yesterday, and it is very much playing out, is that you know, many of our medics are actually reservists, and are therefore working in the local communities. And so, as Secretary Esper said, we got to be really careful, and we're working this really through the states and the adjutant generals, in terms of you know when I would take and mobilize or bring them forward to support the community when they're actually also already in the community. You know, how do we manage that so we mitigate risk? And I think the overall philosophy that you're seeing from the Department of Defense is that our medical capacity is best used for trauma care. So the way we're looking at it is what could I offer up that the Secretary could then offer to HHS or to a governor that would actually take on trauma cases, you know, gunshot wounds, things, right, that actually then frees capacity in the civilian medical community to be able to handle the COVID response. That's the way we're approaching it. Dot, anything on the kits?
Yes, sir. So on the transportation part of it, so the core mission of the Air Force Medical Service is aeromedical evacuation. And we do have the capability to transport contaminated patients. And so, but that is directed by Transcom. So we would allow them to task us to do that. So we do have that capability.
Can you say a little bit more about the capacity you have? I mean, how many beds could that equate to potentially?
It all depends on the situation and the criticality of the patient. And so if they are less critical, I can move more at one time. If they're more critical, I can move less. And I have the medical support staff who have been trained in this transportation isolation unit to be able to handle those patients.
Okay, let's go back up to the front row.
One more thing. Hey, Laura, one of the things that you're going to find, I think, from all of us is that in terms of total numbers that equate to capacity, we're not talking those because very often they're actually also tied to operational plans. And so we don't give total capacity in terms of the number of beds, number of docks we have in that.
Thank you.
Thanks.
Degrees from Reuters. One specific question: if you could give a bit more detail about the sort of the transportation of the test kits and sort of how that's playing out. How many numbers are we talking about? And more broadly, obviously you've talked about the force being young, but exercise is obviously being postponed. Training is being affected. At what point do you think this starts affecting the force, or is it indefinitely just going to not affect the force?
Yeah. So on the transportation of test kits, we're linked up with, again, with HHS, and they're really driving the demand signal. And then our capacity from a global mobility standpoint, we're not limited because we can move a lot of test kits on a C-17 or a C-5. That's not the issue at all. The issue really becomes, competing requirements, right? If I'm going to take a mission and use it for test kits, some other mission is not going to get serviced or is postponed. That's what Transcom does every day. So I don't see any limitation in terms of our ability to move the test kits and the things that HHS is asking for. On the exercises, they do have an impact. Right now, we're early enough in terms of the number of exercises canceled that it's recoverable, right? So I'll give you an example. Red Flag Alaska was scheduled to go in May. We just canceled that. That was within the last couple days. That's a few hundred folks that come to Red Flag, which is for the Air Force, our National Training Center equivalent. It's where we do our highest end training. There is an impact for those that were scheduled to go there. We canceled it for a couple reasons. One, to allow those units to focus at home on dealing with COVID-19. But what I anticipate happening is we will put in place procedures to actually be able to continue exercising, albeit perhaps at a lower rate in terms of numbers, by bringing social distancing and the other CDC protocols in play. And each combatant commander has been given the authority by the Secretary of Defense to determine whether he can continue an exercise with local forces. Given the fact that we've pretty much stopped movement, right? So for instance, if the EUCOM commander, General Walters, wants to continue an exercise and he can get his objectives met with local forces, he has the authority from the Secretary of Defense to move forward on that, just knowing that I'm not going to be sending him forces from outside of that particular area going in. And I think what you'll see is we'll make individual decisions on a rolling calendar as we look at every exercise.
How many test kits have you moved so far? How many test kits have you guys sort of transported so far?
I'll have to do that and find out. I know we've just made a pretty significant movement into Memphis last night or day before. But tell you what we'll do is let me get you the number.
We can get back
if we can. Yeah.
Okay, let's go back out to the line again. We'll go to Nick Schifrin from PBS and then back into the room. Nick, go ahead. Are you still there?
Sorry, I was muted. Can you hear me?
Yeah. Go ahead, Nick.
So just two questions. One, about that movement. Thanks for doing this, by the way. About that movement, you mentioned at the top the seriousness, the importance of maintaining access to level 3 countries. Can you talk a little bit about how much movement you still have that's deemed mission critical, despite the overall guidance, obviously, to minimize movement? And in terms of social distancing, you talked about the clean environment that is the aircraft in general. Can you talk a little bit more about social distancing that you're doing among senior officials all the way down? Thanks.
Yeah, no, thanks, Nick. So first, in terms of movement and what's coming up ahead, what we've done is lashed up our, in typical military terms, we call it command and control, right? So how are we organized for success here in a supporting response to Health and Human Services? So the vice chairman and the deputy secretary are leading the Department of Defense effort. They plug into the vice president's task force, and we have an element with HHS that then helps define the requirements and then communicate those requirements over to the Department of Defense when it's a DoD ask. And so right now we are not seeing any limitation in our capacity to meet those movement requirements, especially when we're talking about small test kits where we can put multiple numbers on a large airplane. So we work those requirements daily. So I don't have a good number for you because I expect that every day we're going to get a new requirement that we're going to meet through Transcom. And then we talked already about how we're going to continue those missions by taking steps to mitigate risk with the crews. You asked about senior leadership. So just to set the example, for the Air Force, I actually, with my vice chief and the Secretary of the Air Force, we are actually doing telework. So I've got Monday, Wednesdays, and Fridays. I actually did telework from the first time yesterday, and spent all day, as you might imagine, working this particular issue. And we're, sending a message to every echelon of command in the Air Force that if the Chief of Staff of the Air Force can do it, then they can too.
Doing that from home? From home?
Yes. And the good news is I've got everything I need, both classified and otherwise, to continue to stay connected.
When did you start that?
Yesterday. Did it all day.
Okay.
Yeah, Mike Lynn with the Washington Times. You mentioned about needing spare parts. I was wondering, how are you dealing with the issue of parts? Because you not only do you have corona concerns, I assume the companies that make the washers and spring, they also have it. Is that causing a problem with that and contracting at this point now for you? And
Yeah.
Can you extrapolate, how long can you go?
No, it's a great question. I can tell you that Secretary Lord, Ellen Lord, is leading that effort, at least in the Department of Defense. She and Mr. Gertz and our acquisition leader, Will Roper, are all looking at the industrial base to look at impacts to keeping our parts supplies on. Right now, to date, we've not seen a limitation that's caused us to pause or affect operations in any way. But this is a concern going forward, because companies have got to figure out how to keep their lines open with their own social distancing and own procedures to be able to protect their workforce. And so this is a constant communication that's led by Secretary Lord with industry leaders to make sure that we can keep the trains running.
Okay, let's go to Bloomberg. Tony Capaccio.
Hi, sir. Can you hear me?
Yeah, Tony.
Okay. During the Ebola crisis, General Silva at Transcom developed an isolation chambers to put on planes, and now those are part of the Transcom mission. They're called transport isolation systems. Can you give a sense of how many of those are in the Transcom inventory, and whether those could be used in extreme situations to move patients from locations to location?
Yeah, thanks, Tony. I'm going to ask Jill Hogg to come up.
Yes, sir. We do have the transportation isolation systems. We do have a limited number of them. I really don't want to go into the specifics based on O-plans, but we do have the capacity to transport COVID positive or any other biologically contaminated patient through Transcom.
Yeah, let me check, though, and roughly how many can be transported on any C-17 or a C-5 or a C-130, just to bound that a little bit. We're not talking scores, we're talking individuals, right?
Yeah, you're talking a relatively small number, less than 10 for each one of these kits, if that helps. And
not a panacea to move people. That's the point I wanted to make.
Yeah, that's right. And the other thing, Tony, I would share with you is that, we got to look at the full spectrum of potential movements, right? There's everything from the fully positive, symptomatic to, and what the, Secretary Esper has asked all of us is, in both a fixed wing and a rotary wing capacity perspective, what is it that we could bring should HHS come to us with that request? And we have that analysis ongoing.
Okay, thank you, sir. Good luck to you.
We're going to go to the back of the room, and then we're going to go to Brian Everstein on the line after that. So please go ahead, ma'am.
Hi, I'm Caitlin with Colorado Public Radio. Thanks for doing this. I have two quick questions. One, and I know it's only been like 5 days, but have you given any more thought to about when the cadets might be coming back to the Air Force Academy? I know some colleges and universities in Colorado have already said that the spring semester is not going to happen, and they'll be coming back in the fall when this is all over. And the second is, how does this affect deployments? How Air Force deployments going out? How will this affect people coming back and going out?
Yeah, thanks, Caitlin. First at the Academy, so we're talking obviously with the Superintendent, General Silveria, and he's talking to their superintendents, and he's got a wider discussion going on with university presidents because really this is a university issue with young people in close quarters where it becomes very difficult to actually distance them from each other. I mean, we have 2 people to every room, sometimes 3. So he made the decision. I approved that, working with the Secretary. Secretary Barrett approved that to allow him to send home the lower 3 classes, but keep the first class. We're on spring break right now. The first class will come back because we need to get them through graduation in May. So that's our focus right now. The others are doing, already talking about distance learning. The dean is working through distance learning, and they'll make a real-time determination on when we think that we can mitigate the risk to the point where we can bring the cadets back. And obviously, we're tracking this in terms of being able to keep each class on time. So this is really a broader university-wide discussion that we're having on taking the right actions. On deployments, we're defining, per the Secretary's guidance, what are mission-critical activities, right? What are those mission-critical activities that we have to sustain and maintain to be able to do what each of the services brings to the joint team? So whether that's nuclear deterrence or global mobility. And so as we define something as mission-critical, those deployments will occur. There has been a specific restriction on movements for the next 60 days, per the Secretary, on movement into and out of level 3 countries. And so we're working through that daily. What's important to know is that there is an exception to policy that the Secretary has delegated to the first general officer in the chain, whether that be in a combatant commander or service chain, to be able to authorize an exemption to that stop movement for purposes of being either mission critical, humanitarian, hardship, something that would cause that general officer in writing to approve that waiver or exemption that exists.
Okay, we're going to go to Brian on the line, and then we'll be able to take 2 more questions after that. So Brian, go ahead.
Thanks again for doing this. You had talked a bit about keeping your global missions flying. Can you talk about the impact of flying hours locally at your local bases and maybe your weapons school and keeping their readiness high as opposed to going to a drop in readiness that followed sequestration? And separately, can you talk about how you're addressing social distancing at places like air operations centers or air crews that are sitting alert that are usually really co-located but mission critical?
Yeah, thanks, Brian. I'm asking to answer the second one first, if that's okay, and that is, as we look at mission-critical activities, we have a number of I would call them operational headquarters, like the Theater Air Control Center that runs all global mobility, the Air Operations Centers who are running ongoing combat operations. Those are facilities that have people that are generally in close quarters, computers that are aligned closely. Right now, commanders are adjusting those headquarters to achieve the social distancing that's required to be able to mitigate the risk and continuing ongoing operations. That's going in all of our headquarters, our operations centers that do global operations. On the flying hours, right now we're able to maintain, we're continuing undergraduate pilot training, and I'm leaving it to local commanders to adjust their flying schedule based on the 3 priorities the Secretary of Defense gave us, right? Which is ensuring that we take care of our people, make sure the mission happens, and then be good partners with our teammates as we do a whole of government response to this. For wing commanders, especially those that are in our main operating bases, they have established close relationships with community leaders, and the community leaders are dealing with our issues downtown, and these are very often where our airmen and families live, work, and play. So they're going to adjust the flying hour program and the flying hour schedule locally, and I don't expect one size to fit all. I don't expect Clovis to look like Tinker, to look like Eglin. I expect each base to actually make a mature, prudent decision on flying hours, and I think it's our job as a staff and my job as the chief to back them up and get them what they need to execute.
Okay, we're going to go to Jeff Shogel at Task and Purpose, and then we'll finish up with Abraham at Washington Examiner.
Thank you. Thank you for doing this. I just wanted to clarify. There are 7 cases in the Air Force. Are these all active duty, or are there National Guard and Reserve airmen in addition to that? And can you say where the airmen who've tested positive for COVID-19 are stationed? Thank you.
I'd say, yes, right now they are active duty. Do you want to jump in on any in terms of locations? I don't know right now we have the exact locations as we go forward. Yeah, we'll get that to you though. And you had a second part of your question?
question is the 7 airmen all the airmen with COVID-19, or are there guard and reserve airmen in addition to that who've tested positive for COVID-19? Thank you.
Yeah, no, it's a good question. Because this is an ongoing assessment daily, I'll tell you what I'd like to do is I will get you all that number. We'll follow up on that.
And Chief, starting within the next 24 hours, we'll provide regular, frequent updates to the press on Air Force numbers.
Okay.
And then let's finish up with Abraham from the Washington Examiner.
No question at this time. Thank you.
Okay, great. Bob, last question.
General, just wondering whether this situation is limiting your ability to recruit right now. Can you keep recruiting stations open and so forth, and interacting with people?
No, Bob, it's a great question. So far, nobody has reported any issues with recruiting. But common sense would say, as the nation limits its movement, at some point that is going to have an impact. What it means is that we've got to do more outreach going there. And I've kept our director of personnel here, and he hasn't had a chance to answer a question. So I'm going to get him up here and give him a chance here on recruiting.
Well, thanks, Chief. On that question, Bob, first, we're lucky enough, right, that we have a little bit of sort of reserve in the tank. We have what we call a delayed entry program, and we've got about 4 to 6 months worth of folks who are on future dates ready for recruiting and being able to ship to go to basic training. So there's a little bit of reserve there to take place. As the Chief said, over time, we would expect that we're going to have to do a lot more outreach from a electronic standpoint and a virtual standpoint, because if it continues this way, certainly with the limits on movement, we're going to have a little bit of impact to recruiting over time. But right now, we're still in a good place. Folks are still going. Schools closing will be a problem, right, for contact and those kind of things. And so over time, we're definitely going to see some challenges, but we think we'll start to work our way through in more of a virtual presence and be able to do that.
Are you already doing that now?
We are. I mean, that's already been part of what we do. There's a lot of online outreach, right? There's a lot of social media and things that'll happen. We won't have as much ability to do the follow-up and the face-to-faces that we have today, but we haven't really seen the impact yet.
I mean, you have actual physical recruiting stations still, right? I mean,
absolutely.
They've not been closed?
They have not been closed.
Thanks. Thank you.
Chief, any final thoughts before we wrap up?
Yeah, just to maybe share with you, one story. So last Wednesday, I traveled down to San Antonio, Joint Base San Antonio, and it was actually the morning after we'd received a number of folks off of Princess Cruise Line. And so I had a chance to meet face-to-face with the HHS leader, Skip Leitner, and his team, the CDC team that was there, the doctors that were there, and then there was a team, New York One, led by Mr. Diamond, who were actually taking care of all of the passengers as they went through. And I will just tell you that it was a real positive experience in terms of seeing the professionalism. I want to just give a shout out to the HHS team that I saw at work there. I mean, it made you proud to be an American. Skip Leitner is an engineer trained in this, and these are like our Air National Guardsmen, right? They're called up, and in an hour's notice, they pack their bag and they head into a crisis. And so everyone I met there was doing something else full-time in their civilian role and then joined HHS to do this. And so it was a very impressive operation. One of the things that we do, of course, is we bring to that team a lot of local connections. And the wing commander down there, the Joint Base San Antonio commander, Brigadier General Laurel Lindemann, who's one of our best and brightest, has established this great relationship with the mayor, Mayor Nuremberg. He joined us for the day and got to see the operation in action. And so this is what we do. We roll in with our sleeves up and help doing defense of civilian support agencies. In this particular case, HHS. And I was really impressed with the operation I saw there in San Antonio.
Thanks, everybody. Have a good day.
Thank you very much for doing it.
Thanks.